Hello and welcome to the session today. My name is Jane Houston and I'm the Clinical Director of Midwifery and Women's Health at Frontier Nursing University. It gives me great pleasure to introduce my colleague, Dr. Tonya Nicholson, who is the Associate Dean of Midwifery and Women's Health for Frontier Nursing University. She has a rich history with Frontier as a 99 graduate for midwifery, the first DNP graduate in 2009, and a women's health nurse practitioner graduate in 2011. Tonya served the women of Central Florida in full scope practice from 2000 to 2006, where she also directed the midwifery service. In 2006, she joined the Frontier faculty and then became the program director in 2010 and the associate dean in 2015. I'm also happy to tell you she's a fellow of the American College of Nurse-Midwives. Tonya currently practices part-time in her hometown of Dublin, Georgia. She has a variety of teaching experience, but the majority has been focused on the prenatal period and in clinical courses. Tonya is very interested in communication and civility at the individual and institutional levels and focuses most of her scholarship in this area. I'm honoured to welcome Dr. Tonya Nicholson. Thank you.
Hi, I'm Tonya Nicholson. I'm the Associate Dean of Midwifery and Women's Health here at Frontier Nursing University. And I want to welcome you today as we talk about improving the family's experience. Every encounter matters. So as we talk today, what I want you to go away with is the idea that every single intersection that we have with a patient and their family makes a difference in their perception of the overall experience as well as their health outcomes. So one of the ways that we can help to ensure that is to make sure that all of the people on our team share a similar mission, that we have the same values, that we share the same desire for the same outcomes, that we understand how we're going to work together to meet those outcomes. Everybody needs to have a clear goal and mission. At Frontier, our mission is to educate nurses to become competent, entrepreneurial, ethical, and compassionate nurse midwives and nurse practitioners who are leaders in the primary care of women and families with an emphasis on rural and underserved populations. You know, one of the most important tools that we have in healthcare is right there in the word, care, caring. Seems like it's very simple. It's something we learn about in kindergarten. But so often we either have misplaced that tool in healthcare or we're misusing it, kind of like this. You know, in kindergarten we learn how to treat one another. We learn about being kind to one another and being civil, how to act like we were not raised by wolves. And that's what part of this conversation is going to be about how our behaviors make a difference in the outcomes for women and families. You know, just because everybody's doing something does not make it right. In our current culture, 95% of Americans believe that incivility is a problem, and 70% believe it has reached crisis proportions. Most people encounter incivility more than twice daily, and 80% of people believe it's leading to an increase in violence. Over 75% of nurses experience or witness an act of incivility every day in their work setting. The most frequent uncivil workplace interactions often occur between peers, but the Joint Commission says that healthcare facilities have to have a leadership standard that identifies a code of conduct that defines uncivil, intimidating, or inappropriate interactions and has a plan to manage uncivil behavior with a zero-tolerance approach. Now, what happens when incivility reigns within the healthcare setting? On the left, you see that for the staff, it means there's a loss of time. People don't stay in their jobs. They don't want to come to work. They have decreased job satisfaction, productivity, and morale. Often they think of the workplace as a battlefield or a place of professional terrorism. Those are the words that people used. But even more importantly, look on the right. What does that mean for patients? It means that their healthcare costs are increased, that they're not satisfied with their care, and that they are unsafe. When we have to continually orient and hire new people, when we have to take a lot of time managing interpersonal issues between staff, the patients are not getting the care that they deserve. This is a very interesting slide that talks about the fact that healthcare is moving toward a more holistic approach to care and payment, saying, hey, let's take a look at the whole experience. How do patients rate their experience? Not only did they get the right diagnosis, were they treated well as far as their treatment plan, but how were they treated? How were they cared for? And so as we look at this new way of being accountable for the care that we do, we know that the experience is more than just us providing care, but the patient has to become a partner in that care. Now, nurse midwives and nurse practitioners have been doing that, but we are starting to see that it's becoming more of a measuring tool across all healthcare. These are some of the words that patients used when they rated their healthcare as high. They said they were comfortable, they were relaxed, they felt heard and understood. So I'm going to ask you now to think about healthcare from the perspective of a mother and a child. Now, this particular situation was me and my son. The lessons that we can learn about how to look at things differently can be taken from a situation like ours and applied to most any healthcare situation. So I'm going to ask you to do that. So meet baby Seth, sweet baby Seth as I call him. He was a champion wrestler. He was a football player, a friend, a brother, a son. He was well loved. He was strong, confident, and agile. He had an almost musical quality to his movements. And then we had our own personal due day. It was on March the 2nd, 2014. As parents, that dreaded phone call that you get that he was in a very serious accident, and even worse, he was more than a state away. So we had to make the drive trying to find out along the way what had happened. Was he really alive? You know, I couldn't believe it. I thought they were lying to me. When we got there, there was a surgeon that was the on-call surgeon because he was airlifted to a trauma center. The on-call surgeon, comes comes strolling into the room with an air of confidence and, to be honest, cockiness to tell us exactly what he would do and how wonderful he would do it, and et cetera. I don't think he made eye contact with me or with Seth one time. I felt a little uncomfortable, but I was vulnerable. Now, remember that I am a healthcare provider, and in that situation, I still was vulnerable. I was first a mother and then a healthcare provider. And so while I could not bring forward with me all of the training and education that I had, all I could see at that moment was my child in this serious situation. A friend of mine, well, actually she's now a friend. I'll tell you that prior to this occurrence that happened, we were not really friends. In fact, I might have even said she didn't like me very much, and maybe I didn't like her very much. But she put in a call to me because she was a nurse on the neurosurgery unit, and she saw Seth's name on the surgery schedule. She put in a call to me, and she said, do not let this surgeon touch your child. She told me that he was a diva and that he did not provide much care to his patients, and that very often they returned to have follow-up surgeries where the surgery was unsuccessful. I decided to trust her. You know, you can always trust the nurses, right? I decided to trust her, and I got a second opinion from a surgeon who came in, took a lot of time talking to us, asked us what was important to us, asked me, Mama, what are you worried about? Said to Seth, Seth, you're the patient. What do you need? What are your priorities? The diagnosis was not different. The diagnosis between surgeon 1 and surgeon 2 was the same. Seth had fractured T6, 7, 8, 9, 10, 12, and L1. He had a burst fracture at T12. He needed surgery. It was very critical. The diagnosis did not change. The approach to our care changed. My perception of the surgeon, my perception of my trust in the surgeon changed. I wanted somebody who would listen, somebody who cared, or at least somebody who acted like it. A recent study of 61 subjects asked, what do you want in a provider? They wanted 3 main things: somebody who listens, someone who is caring and compassionate, and someone who explains things well. None of them said they want somebody who was the fastest or somebody who gave the best diagnosis. It wasn't even about their outcome as much as what they wanted was somebody who cared and acted like they cared. The biggest communication problem that we have as healthcare providers and probably as people is that we don't listen to understand. We listen to reply. So here we're going to back up a minute and talk about what are some basic ways to have effective communication. So you can read this yourself, but mainly I'm going to say that you take a minute. You take a minute and you live in this minute. You focus on what is straight in front of you with the client, with the family, with the people that you're interacting with. You ask them what they are seeing, what they are feeling, what they need, and you acknowledge the common ground that you have. Our intention is that you become X, Y, and Z, that your outcome is X, Y, and Z, and that we're going to work together to have this happen. One of the most important things that happened with us is that they all acknowledged who mattered in the situation. We spent 9 days in the trauma ICU. The policy at that time at the hospital was that families could not stay on the unit at night. However, they did not ever actually bodily remove me, so I did not actually ever leave. They acknowledged, actually in words many times, they would talk to Seth about something. They would say, now, Mama, what do you think? And they would say to Seth, we know what your mama thinks matters, so we want both of you to be listening to this. Do you want us to wait on your mother till she gets back if I had run out to get something to drink? One of the findings of a large study conducted over 2 years by the Schwartz Center found that 2 characteristics of compassionate care were, one, that they showed respect for the patient and the family, and that they involved the patient in the decision making. I want you to know that the radiology folks here at this hospital, they knew my name. They knew Seth's name. They asked me about the other boys. Now, remember, this was not in my local hospital. This was in a trauma center an hour away, but they made a point to get to know us. They even followed up with us later after we had left the trauma unit. The diagnosis that Seth received was that he was paraplegic, and the prognosis was that he would not walk, have bowel, bladder, or sexual function. This was a very scary diagnosis. This was a very scary prognosis. But I want you to know that not the people that told us that, you could say they were the onstage characters, they were the doctors and the nurses, but backstage, there were people that made the show go on. They made the experience seamless. They were the backstage players. They were people like Bella, like Sam, and like Sally. On the right, you have Stella. She's got the pink on. Sam in the back, his face is circled, and Sally's face is circled. She's in the purple. Sally there in the middle, the very first night, as we came in, they made sure that we knew everybody that was on the floor. And I walked out of the room after they had used the word paraplegic. This is when we were moved to Shepherd's Spinal Clinic, and I'm going to tell you what, that is a place to go if you have an issue, and I'm not an advertiser for them. When I walked out of the room, I could barely hold myself together, and Sally was at the receptionist desk and could see me. She walked from around the desk. She took my hands and she said, right now he needs you. You go in there and you be strong, and I'm going to stand out here and cry for you. Now, that meant something to me. Her compassion, her attentiveness to my needs. Sam in the back there, one day Seth had a very, very bad morning. He specifically that day had a urinary tract infection, but at the time we did not know that. And so he was really down in the dumps. He did not feel like going to therapy. Sam came in. He was cleaning the floors. He sensed, of course, that Seth was not his normal self. And so Sam said, you look like a country boy. What do you know about guns? Well, over the next little while, Sam and Seth talked. Sam was a veteran, and so he knew quite a bit about firearms, and my country boy does know quite a bit about hunting and fishing, and so they had a lot to talk about. I walked out because I knew Sam's job was not to cheer Seth Nicholson up, but I walked out and I said to the receptionist, who that day was not Sally, and I said, I hope Sam's not going to get in trouble. He spent a lot of time with Seth this morning. They're chatting and having a good time, and it's really been good for Seth. Please, I hope he doesn't get in trouble. And the receptionist said, Mr. Shepard's been around. Now, this was the younger Mr. Shepard who was in a chair. He was the reason that Shepherd's Spinal Clinic was actually even opened. Mr. Shepherd's been around this morning, and he won't be upset about this at all. We are constantly told that if a patient or a family member needs you, you put aside your task and you take care of the person. That spoke volumes to me. But probably the very first experience that we had that told me that these people cared about us, that proved it to me, was with Miss Stella. Miss Stella's there on the right in the pink. I often say that the power of Splenda put Seth on his feet. Well, really, it was Miss Stella. What happened was the very first night after that terrible diagnosis, I went down to the kitchen area. I was making coffee because, boy, I needed some coffee, and there was no Splenda, which is my preferred. And, by the way, I'm not being paid by Splenda either. I was trying to make the coffee. There was no Splenda. I started crying, obviously not crying about Splenda. But Miss Stella walked by, and she said, "Honey, what's wrong with you?" And so I just said, "I was trying to get a cup of coffee, and there's no Splenda." And she said, "Let me call downstairs." So she called down to the cafeteria. They did not have any. She said, "You go on back to your room. Give me about 10 minutes. She walked across the street to Rite Aid, and she came back with a small box of Splenda. And she said, "Now, don't you worry, honey. There's going to be Splenda in this kitchen every time you come from now on." And there was. Now, clearly, this chemical did not make Seth get on his feet. But what did was our trust in the fact that this group of people cared about us. Stella, Sam, Sally, the nurses, the physicians, the therapists, they all cared for us, not just for the diagnosis, not just for the prognosis, but they cared about us as people and what our needs were. And because I then trusted them, Seth trusted them, understanding that caring about all of us mattered. It made a difference in what the service standard was. It became, we were guests there, and they treated us like that. Our needs and our wants mattered. Our emotions mattered. They cared about who we were, not just the stereotypes. Not only did they care about us on bad days, but they cared about us on good days. There were many celebrations of victories. The staff came together to celebrate all kinds of milestones. For us, it was getting his permanent chair. It was being awarded those never quit gloves that were in his lap there. It was the graduation to day services, the out of 24-hour care. It was all of those things. For you, it might be a patient who has a biopsy that comes back negative. It might be the end of chemo, or it might be a birth that went the way they desired. But they cared for us in good times and in bad times, and it mattered. Our own home community mattered and cared about us. The chief executive officer of our hospital gave me a call and said, "We want to be a part of Seth's success story. Seth's ability to walk or not should not be because of us living in little bitty Dublin, Georgia. What can we do to help?" And I said, "We need X, Y, and Z equipment. I need a therapist to learn what Seth needs because of the severity of his injury." They subsequently sent Jason, who is there in the stripes, who is a therapist at our local hospital. They sent him to learn what we needed and to get a look at the equipment that we were talking about. That mattered to us, and then our trust in our local community increased. There, we were cared for as a whole person. They looked at Seth not as a diagnosis, but as an individual. This was another of the findings of that Schwartz study that I have talked about. They listened from day one to our thoughts about what we needed and to our whole person. And that's what the Schwartz study said, that we're not looking at a diagnosis, but an individual. This is one of the things that I wrote on this particular day as we were talking and thinking about Seth's day. We were there 16 weeks, by the way. I wrote, "Seth is Seth. Right now, he needs adaptive equipment to live his life as fully as possible. We don't know how long that will be necessary, maybe forever, maybe not. But either way, he is still my sweet baby Seth, who flirts with all the nurses without regard to age, weight, or ethnicity. He loves all the women. He shakes hands with everybody and jokes with them. He is inquisitive about everything going on. He tears up when I do, and he prays for his friends, and he has praise aloud for our daily miracles. It occurs to me that maybe he is more fully Seth than he has ever been. Maybe the sparing of his life is more than a miracle in the physical sense. A few last lessons about life and healthcare. What is love? It is washing your brother's legs when he can't reach them. It is dressing your brother when he can't reach his pants. It is imagining new ways to help your brother to do the things that he has always loved. It is bringing Splenda to a crying mother. It is absorbing the cost of training someone for a task he or she may not do very often to meet the needs of the one who needs it most. It is shouting and jumping up and down when a young man who is not expected to pees, or when the biopsy comes back negative. It is stopping, looking people in the eye. It's answering the same question again because the patient could not believe the answer the first time. It's having a smile in your voice when you answer the phone call, or the phone, or the light for the 75th time this hour. It's taking an extra minute when you do a blood draw because of your patient's fear. Laugh with me at the current state of affairs in our room. This was back in the day that Seth was there. Seth is on a shower chair, clothed in what you normally wear in the shower, you know. Logan has his shirt off, that's his brother, his jeans and his boots on, and he is spraying Seth off like he's washing a dog. There's lots of laughter as the boys play in the sprinkler. I'm getting a break from bath time tonight, and I just hope Logan's boots don't get too slippery. I'm sitting on the bed with my pants rolled up and my shoes off just in case I'm needed. What I picture is this. I hear them talking away, probably about guns and hunting, and I think I would call this picture, Joy Comes in the Bathroom. This was just a year ago, 2 years after his accident, as Seth walked across the stage. Maybe we should say he limped across the stage. We will never be the same. He will always have a limp. He may never be able to gracefully dance, and he might not be able to chase his babies. In fact, he'll say to me, you need to stay in shape so you can chase my children. But we are so blessed. So let's put this in the context of you and your patients. For those that have faced difficult diagnoses, treatments, tragedies, even once they're past the crisis, there are still moments in which they feel vulnerable and in which they grieve. I grieve the loss of innocence. I know bad things can happen. So your recovering patient may be acting more normal than they feel. Our experiences shape us and change us forever. Each of you are part in vulnerable people's experiences every day. You're shaping and impacting them at every interaction. Your superpower is caring. This was the story of a family, a mama, a boy, and a health care community that didn't forget to care. There's still just a little bit of tragedy to me as his mother, but to Seth and to this healthcare community, there is joy and triumph. As he limps into a room in ICU to face the patients entrusted to his care, and to think that it all started with Splenda. So in this hour, in this house, we do second chances, grace, real, mistakes, I'm sorry, loud, hugs, family love. I'm so thankful for the opportunity to share our story today, and I hope that you see the lessons to your healthcare team. The most important word in healthcare is care. You can be awesome. You can do this. You're a part of families and caring for families. Thank you so very much.